Hello, I'm Greg Jamian, and welcome to Boomer Health at Home. As more baby boomers receive medical services at home, there are many questions that pop up that require sometimes quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hello and welcome to another episode of Boomer Health at Home. I'm your host, Ryan Donnellan. On today's episode, we're going to talk about the physiology of wounds in your body and steps that you can take to promote quicker wound healing, and also how you can assist if someone has a chronic wound in their life. Today, joining us is an expert, managing RN for AmeriCare Medical Incorporated, Lisa Pleiness, as well as registered dietitian, Laura LeBlanc.
Hi, Ryan.
Guys, thanks for joining me today.
Thank you.
So, when it comes to wounds, what are some basic and underlying factors that interfere with healing?
Well, it could be a lot of things as far as health and nutrition. That's probably the most important one. A person that's bedridden, that doesn't have good circulation, doesn't have air quality to the wound. The wounds need air. Health conditions such as diabetes, hypertension, old age, incontinence, being bedridden. There's many things, but it's the stasis of blood in the body that ultimately causes a wound, starts a wound, and pressure.
Okay, so that's kind of start of the wound. Can you explain the phases a wound goes through to heal?
Well, without getting into the anatomy and physiology of it,
Yeah.
There's between 3 to 5 stages of wound healing, and depending on the depth of the wound. Usually, like if we had an abrasion that opened up, burnt ourselves, cut ourselves, a minor cut, burn, they would go through 3 phases, with the first one being the clotting phase and the last one being the healing of the skin. Depending on the depth of the wound, there could be between 3 to 5, probably 5 stages. And some wounds are chronic and never heal.
Oh, and how can diet, Laura, affect the healing process?
Diet's really key, and one of the main things that we focus on is protein and some of the vitamins and minerals that are required. It's a known fact that glutamine and arginine, which are components of protein, actually promote tissue growth. So if you're not getting enough protein, then you are at greater risk of not having the healing benefits. It may expedite the healing.
Okay, and what exactly, you were mentioning people lying in bed and you hear bed sores. What exactly is a bed sore?
A bed sore is it's a tissue damage where the wound actually starts to open up because of the pressure, and it's usually areas of bony prominences like the coccyx, which is your tailbone, your heels, just elbows, any bony prominences. And it's a pressure ulcer that opens up and hopefully will heal. Sometimes they don't heal. That's what a pressure ulcer is.
Okay, now if someone has this, for both of you, how are these wounds treated? Like a chronic wound, someone has a bed sore, what would be the intervention you guys would take?
Well, being a nurse, the first thing I would recommend is, the patient needs a physician to see this wound and give orders to what we can provide as far as wound care. A nurse cannot go in, even if she's a wound care nurse, she can usually tell the doctor, okay, I think this needs to be done, this, and the doctor needs to agree and sign that that's okay that we do that. So getting an order is the first thing that we would do. If the patient is homebound, we could have a company or a home nurse come in, such as even AmeriStaff, our company. I can go in, we can do an assessment on the patient and recommend then that their further treatment. Usually the first step is to see a physician, whether it's a family physician, and they may recommend then like a wound clinic for the patient to see and then have wound treatment there.
Is this only done in a hospital, or can wounds be treated at home as well?
Oh yeah, they can be treated at home. Depending on the insurance company, of course. Medicare, home care would provide services if it's a new wound. Usually chronic wounds, there's a length of time that they'll come out and treat it, but if it's an ongoing non-healing, then Medicare will usually only provide maybe 9 weeks of service and maybe an additional 9 weeks. Private pay, our company Ameristaff, we will come in, it would be private pay. There are some Blue Crosses that we do accept and it is covered as well as if it was a auto injury, a wound from an auto injury, which we would cover at 100%.
Okay, and then a dietitian could also help with the...
Oh, absolutely, especially if we see a decline in the wound and we're doing everything that we can to treat it. I think education is key too, when you agree, because eventually the nurse or whoever's caring for them may not continue services. So I always find that it's important both for the nutrition aspect and treatment for family to get involved, or caregivers.
And hopefully education enough.
Education, yeah.
Enough to maybe cause help with preventing it altogether.
Absolutely.
Prevention is the number one.
What do you look for when assessing a wound?
The stages of a wound prior to it even opening up. If it's red, you can tell that would be a stage 1. It goes up to a stage 4, 4 being the worst, where there's tendon, bone, ligament, visual. You can visually see that. So depends. The care of it depends on the staging of it. If there's thick skin over top of it, sometimes you want to cover it with a dry dressing, a moist dressing. There's many, many variables, and again, this is where all falls back onto the physician prescribing what he wants treatment for that wound.
Okay, so it covers the chronic. Now, if you have just like a laceration or something like at home kind of first aid, what should someone do to dress the wound of that nature?
Depending on the depth of it again, but if it's just a minor laceration, you cut your finger, you were peeling carrots, cut your finger, as long as it doesn't need stitches. You would definitely, first thing you want to do is wash it and open up the area a little bit as much as you can. I know it's going to bleed, for a while. Wash it good, put antibacterial soap in there, and then wrap it and hold pressure on it to try to stop the bleeding. And then just any kind of ointment, Neosporin, anything like that. And just something minor. Like that. You can buy butterflies in the store now, which are the wound closures.
Like Steri-strips.
Steri-strips,
right.
Yeah, we call them Steri-strips. I think they still call them butterflies at the pharmacy. So
right, they're kind of like little X-looking Band-Aid type things.
You can ask the pharmacist and they'll help you too. But just make sure you have on hand some sterile dressings, bandages. Make sure your ointments, are not expired. And I always recommend too, and I always do this with my patient, whether I'm spraying a wound or applying an ointment, is I always squeeze out the first little bit of ointment at the end of the tube if it's been open prior, and get rid of that. Or wound spray, I always do a few sprays of the spray bottle and use an alcohol wipe on it, because there's always bacteria at every opening, so you want to make sure that bacteria is out of there before you put it into your wound.
Well, thank you guys. It's very informative. Unfortunately, that's all the time we have for today, but I'd like to thank you both for coming on the show, and we hope you enjoyed this segment back home. And if you have any questions about anything you saw today and would like to speak with one of our nurses, please call us at area code 248-288-2270. Thank you for watching.